أعزائي طلبة المرحلة الثانية، السلام عليكم ورحمة الله وبركاته. اليوم محاضرتنا عن Posterior Abdominal Wall. The posterior abdominal wall consists from in the midline from the 5 lumbar vertebrae, 5 lumbar vertebrae with their intervertebral discs. Laterally, it has the 12 rib and the upper part of the pelvic bone, that is the upper part of the ilium. The muscles that are forming the posterior abdominal wall, these are the two psoas muscles, psoas major, psoas minor, quadratus lumborum, iliacus muscle, quadratus lumborum, as we can see here, the two psoas muscle, and the iliacus, and the upper part of the diaphragm. So these are the structures that are forming the posterior abdominal wall. On the posterior abdominal wall, we have certain structure that is attached to it. We call these structure are retroperitoneal. Why they are retroperitoneal? Because they are covered partially by peritoneum and they are tethered on the posterior abdominal wall. From these structures, this is the inferior vena cava, aorta, kidney, suprarenal gland, and the ureters. All these structures are called retroperitoneal. They are situated behind the peritoneum, tethered to the posterior abdominal wall. The first structure that is important to be studied is the abdominal aorta. Abdominal aorta, it is important to be studied. Why? Because of the clinical application on the aorta, which is the catheterization اللي هو قسطرة الشرايين. The abdominal aorta enter the abdominal cavity through the aortic opening. This is the opening in the diaphragm at the level of the 12th thoracic vertebra. Then it descends down in front of the lumbar vertebrae until it divides at the level of the L4, that is the bifurcation of the aorta at the level of L4, fourth lumbar vertebra, into two main divisions. The branches of the aorta have a midline branches. These are midline visceral branches, lateral visceral branches, lateral parietal branches that supply the wall, and the terminal branches. The midline visceral branches are the celiac trunk, superior mesenteric artery, and the inferior mesenteric artery. These branches, midline visceral branches, it will supply the GI tract. The celiac trunk will supply the foregut, the superior mesenteric artery will supply the midgut, and the inferior mesenteric artery will supply the hindgut. طبعا هنا عندنا الceliac trunk will supply the foregut with its derivative يعني liver, gallbladder, spleen, and pancreas. The lateral visceral branches supply the organs or the viscera that's situated laterally on both sides of the aorta. These are the suprarenal artery, renal, and the gonadal, that is the testicular or ovarian artery. The parietal branches that supply the wall, posterior abdominal wall, these are the inferior phrenic artery that supply the diaphragm, the lumbar arteries that supply posterior abdominal wall, and the median sacral artery. As we said before, the aorta will bifurcate at the level of the fourth lumbar vertebrae. This is the bifurcation of the aorta into two common iliac artery. The two common iliac artery. The common iliac artery will divide at the sacroiliac joint into external iliac and internal iliac. We can see here that at the bifurcation of the common iliac artery, the ureter will cross this bifurcation and it will enter the pelvic cavity. The internal iliac artery will pass to the pelvis to supply the organs, pelvic organ, while the external iliac artery will follow the medial border of this muscle, which is the psoas major muscle, and then it passes under the inguinal ligament to become the femoral artery. Femoral artery, which is the main blood supply to the lower limb. The external iliac artery, it gives two important branches. One that pass laterally to the anterior suprailiac spine. This is called the deep circumflex iliac artery. Deep circumflex iliac artery passes toward the anterior suprailiac spine to supply the anterior abdominal wall. And another one that passes medially, upward and medially, called inferior epigastric artery, that passes up until it reaches the arcuate line of the rectus sheath to pass in the rectus sheath. So it has two branches, deep circumflex iliac artery and the inferior epigastric artery. As we see here, the inferior epigastric artery is medial to the deep inguinal ring. This is a summary to the branches of the abdominal aorta. We can review them. 3 anterior branches to the viscera, that's 3 anterior visceral branches, unpaired. 3 lateral paired branches to the viscera, and 5 lateral paired branches to the parietes, that's the ball, parietal branches, and the 3 terminal branches, that is the right common iliac, median sacral, and the left common iliac artery. Relation of the aorta. The inferior vena cava lie on the right side of the aorta. Also on the right side in the abdomen we have the cisterna chyli and the beginning of the azygos vein on the right side. While on the left side of the aorta we have the left sympathetic trunk. As we said before, the clinical application it is important to study the anatomy of the aorta. This is to know the principles of the procedure, which is called the aortic catheterization. From here we can see that the catheter is passed through the femoral artery to the external iliac, to the common iliac, and then through the abdominal aorta, thoracic aorta, and then to pass in the aortic arch to reach to the coronary artery to do either therapeutic or investigation to the coronary artery. The inferior vena cava. Inferior vena cava, this is large vein to drain venous blood from the lower part of the body below the diaphragm, to drain blood to the right atrium of the heart. The inferior vena cava, we can see here from this figure, it is in the abdominal part, it is longer than the aorta. The aorta lies on the left side of the inferior vena cava. What are the veins of origin? That is, the inferior vena cava is formed on the posterior abdominal wall at the level of the 5th lumbar vertebrae by the union of the right and left common iliac veins with the median sacral vein. The inferior vena cava is formed behind the right common iliac artery. Formation of the inferior vena cava at the level of the 5th lumbar vertebrae, then it ascends up on the posterior abdominal wall until it reaches the level of the T8, 8th thoracic vertebra, where it enters through the central tendon of the diaphragm to pass to the thoracic cavity. The inferior vena cava passes through the diaphragm, through the central tendon of the diaphragm, through an opening called cable opening at the level of T8. What are the tributaries of the inferior vena cava? In the abdomen, it has 2 anterior visceral tributaries, 3 lateral visceral tributaries, 5 lateral abdominal wall tributaries, 3 veins of origin. هنا راح نشوف this is the inferior vena cava. These are 2 to 3 anterior visceral tributaries which are the hepatic veins. These are the veins that's coming from the liver here. It will drain directly to the inferior vena cava. 3 lateral visceral tributaries. These are the right suprarenal, renal vein, and the right gonadal. We have, why we don't say the left suprarenal? Left suprarenal will drain into the left renal vein, and the left gonadal, also the left gonadal will drain into the left renal vein. These are the 3 lateral visceral tributaries. Lateral abdominal wall tributaries, these are that's coming from the posterior abdominal wall. These are the inferior phrenic vein, it will drain into the inferior vena cava, and the lumbar veins that's coming from the posterior abdominal wall, drain to the inferior vena cava. What are the relations of the inferior vena cava? What are the structures nearby to the inferior vena cava? These are, we can see here, the aorta is on the left side of the inferior vena cava. The right ureter, it is on the right border of the inferior vena cava. The epiploic foramen here, this space, epiploic foramen is separating the inferior vena cava from the portal vein in front. Another important relation posterior to the inferior vena cava is the right sympathetic trunk. We can see here that the gonadal vessel, the right gonadal vessel, will cross anterior to the inferior vena cava. What are the lymphatics on the posterior abdominal wall? We have the pre-aortic lymph nodes and the para-aortic. Pre-aortic is situated in front of the aorta. These are celiac node, superior mesenteric node, and the inferior mesenteric node. The para-aortic, or another name, is the lateral aortic or lumbar lymph nodes that's situated on both sides of the aorta. These are the pre-aortic that's situated around the origin of the main vessels, 3 midline visceral branches اللي هي celiac nodes around the celiac trunk, superior mesenteric node around the origin of the superior mesenteric artery, and the inferior mesenteric nodes around the origin of the inferior mesenteric artery. These are the para-aortic or lumbar nodes situated on both sides of the aorta. The pre-aortic, para-aortic lymph node will drain lymph from different regions. The pre-aortic lymph node will drain the lymph from the GI tract, that is from all the gut tube and their derivative, and from the lower 1/3 of the esophagus down to the upper half of the anal canal, from the spleen, pancreas, gallbladder, and liver. While the para-aortic drain lymph from structure on both sides of the vertebral column, that is the kidney, suprarenal, testis, ovaries, uterine tube, fundus of the uterus in the female, abdominal wall, and the common iliac nodes. Here, from this lymph node, it will lead to the right and left lumbar trunk with the intestinal trunk. It will form the cisterna chyli. Cisterna chyli, this is a dilated sac that contains the lymph, situated on the posterior abdominal wall at the midline in front of the first and second lumbar vertebra. From the cisterna chyli, the thoracic duct will ascend up. This is the two right and left lumbar trunk with the intestinal trunk. They will unite to form the cisterna chyli, and the cisterna chyli will continue as the thoracic duct that ascend in the thoracic cavity. The last part of our lecture is the lumbar plexus. The lumbar plexus, this is a plexus of nerve. We can see from this figure, plexus of nerves that is formed within the substance of this muscle, which is called the psoas major muscle. some of its branches will pass from the right side, some of its branches from its يعني راح يكون from the lateral side, some from the medial side, and some from the anterior surface. It is formed from the ventral rami of the upper four lumbar nerve, يعني L1, L2, L3, L4. Ventral rami will form this lumbar plexus. It is formed in the psoas muscle from the anterior rami of the upper four lumbar nerve, and the branches of the plexus emerge from the lateral, medial, and the anterior surfaces of the psoas muscle. شوفنا هنا branches. This is the psoas major muscle. These are the branches that is emerging from the lateral side of the psoas major muscle. These are iliohypogastric, ilioinguinal, and the lateral cutaneous nerve of the thigh, femoral nerve. From the anterior surface we have this one, the genitofemoral nerve, and from the medial side we will see another branches. From the lateral border, these are the nerve that is emerging. It's called iliohypogastric nerve, the first one from above downward. Iliohypogastric, ilioinguinal, lateral cutaneous nerve of the thigh, and lastly the femoral nerve. All these are from the lateral border of psoas major. From the medial border we have the obturator nerve and the fourth lumbar root of the lumbosacral trunk. From the anterior surface we have the genitofemoral nerve. Here we can see these nerves are arranged from above downward from the lateral margin of the psoas major. These are the iliohypogastric, ilioinguinal, lateral cutaneous nerve of the thigh, and we can see how it is passing in front of the iliacus muscle to the lateral side to pass below the lateral side of the inguinal ligament to supply structures skin on the lateral side of the thigh. And the femoral nerve, this is the femoral nerve passing in between psoas major and iliacus, and then into the femoral triangle below the inguinal ligament. This is a diagram showing the nerves that is emerging from the lumbar plexus. These are from the lateral side. We repeat them. Arranged from above downward: iliohypogastric nerve, ilioinguinal, then lateral cutaneous nerve of the thigh, the femoral nerve. From the anterior surface, this is genitofemoral nerve, and from the medial side we have the obturator nerve and the lumbosacral trunk. The obturator nerve, this is the obturator nerve. It will pass in front of the sacroiliac joint. This is the sacroiliac joint. Then on the lateral wall of the pelvis, lateral pelvic wall, to reach to the obturator foramen, and it will pass through the obturator foramen to the medial side of the thigh, or to the adductor compartment of the thigh. While the lumbosacral trunk, this is what we call the lumbosacral trunk, is formed by the root from the fourth lumbar nerve, and this lumbosacral trunk will pass in front of the ala. This is the ala of the sacrum. And then it will join the first sacral nerve to share in the formation of the sacral plexus. Thank you.